my chorda tympani nerve has two functions, general visceral efferent and special visceral afferent. So if you remember, the special visceral afferent is the taste fiber coming from the anterior two-thirds of the tongue, except the circumviolet papillae. Now let us go further. Once it comes out to the stylomastoid foramen, it gives branch to the digastric belly, that is posterior part of the digastric belly, posterior belly of the digastric, we can say. Then it gives branch to the stylohyoid muscle. So it gives branch to posterior belly of the digastric and stylohyoid muscle. Further it goes and travel through the parotid gland, superficial to retromandibular vein and the external carotid artery. So this is my retromandibular vein and external carotid artery. I'm just drawing the relation of the external carotid artery, retromandibular vein with the facial nerve. So facial nerve is the first. So we have the nerve, then we have the vein, and then we have the artery. Now the taste fiber from the anterior two-thirds of the tongue is carried out by the chorda tympani nerve. The chorda tympani nerve will take the fibers through the geniculate ganglion to the nucleus of the facial nerve. From here, the fibers are relayed to a structure called tractus solitarius. So this is, say, nucleus for the tractus solitarius. This is the one which will differentiate the taste sensation of the anterior two-thirds of the tongue, whereas the superior salivatory nucleus is the one which will be concerned with the sublingual and submandibular secretion. The lacrimatory nucleus is the one which will be concerned with the lacrimation of the lacrimal gland. Now, the additional muscles which is supplied by the facial nerve is your occipitalis and auricular muscle. So beside your muscle of facial expression, posterior belly of the digastric stylohyoid, I get occipitalis on the posterior side of your skull, along with the auricularis muscle which is present around the auricle, are supplied by the facial nerve.